We continue the life history of Dr. Ambrosoli. Generosity and austerity is not as common as with Father Giuseppe. The Kalongo Hospital is built as a result of the generosity of so many people. Beginning with the brothers of Father Giuseppe, certainly the greatest benefactors of the hospital. And then all the friends and organizations that allow him to have what is necessary for a hospital that expands more and more. Among the necessities for the hospital, there are all the new and very expensive instruments that he brought with him to Kalongo after having wandered through the Italian hospitals during his holidays, which only had the name of holidays because he spent the entire period of the rest in his homeland to perfect his art as a surgeon, to look for material for the hospital, to contact the support groups, and to visit the families of the Comboni missionaries and sisters or of the doctors who are working in Kalongo. A lot of money really passed through Father Giuseppe's hands, but he didn't feel like the owner. He managed it like a careful and thrifty administrator. He always showed to be careful, free, and also towards the money he inherited, never complaining or never claiming to be his possession. Poor then to be free as a good Lombard. He was used to saving and against any waste. In the warehouses of Kalongo, not a single bandage went wasted. Waste was absolutely forbidden. For example, Father Giuseppe was very demanding about saving water. He was very careful so that the sick were never short of precious washing hands before surgery, and he invited everyone to save it. Even when washing hands, always with soap, not with detergents. Only the necessary water had to be used. We have 2 elbows to close the tap when the water is no longer needed, he used to say. For the sacrifices Father Giuseppe Ambrosoli made, unfortunately, it had a toll in his life. The first signs of illness. At the end of 1973, Father Giuseppe had to return to Italy. The intense work in Kalongo began to leave its mark. In January 1974, he was admitted to St. Anna Hospital, Como, in the orthopedic ward of Professor Fioroni, and there he remained for a few days in traction for a disc lumbar sciatica in the hope of avoiding an operation, which, however, became necessary. On the 21st of January, he had already returned home. He, however, had to wear a semi-rigid bust for a month, but as soon as possible, he started running around again. Also, these holidays, like the others, turned into a fast race. Father Giuseppe went from one operating room to another to perfect his surgical skills. Meet support groups that collect medical equipment for him that would otherwise be thrown away, but that in Africa it was still possible to use profitably. He was always looking for new hospitals, new ideas, new methods, equipment, and funding for the hospital. The Sundays, instead, he dedicated to the inevitable visits to the families of his collaborators, both brothers and sisters and lay doctors. Mama Palmira, by now very old, would have loved so much to have him for herself, but surrendered to the situation, hoping that her son would return soon to the mission. When my father, Giuseppe, is in Ronago, she used to say, I never see him at home. I hope he will return soon to Kalongo. At least he will have some rest there. Despite the increasing difficult situation that Amin was creating, the hospital continued to improve and grow in constructions up to capacity of 370 beds. In addition to the maternity, pediatrics, medicine, surgery, gynecology, radiology, and infectious diseases wards, there was now also a ward for the malnourished people, the leprosy, and the tuberculosis patients. The word of the poor, called lochken, which in the local language means people without assistance. It was also built to help the poor family members who accompanied and cared for the sick relatives in hospital. The servants of